guys, this is Dr. Colton and Dr. Brady with Concise Chiropractic. We're here today to talk about one of the most common questions we have. What kind of stretches do I need to do when I injure my low back? So low back injuries are one of the most common things we see here, and typically what happens is we have an injury to the lumbar discs that become irritated and either cause sciatica or just general pain into the low back. So the mechanism of injury for most people, they go to bend forward or twist and they feel a pop in the low back or tightness in that lumbar region. So what's really happening there is as you flex the spine forward, the disc bulges to the back there, and in the posterior lateral portion, the side portion of that disc, is where the ligaments are the weakest. So that causes that disc to bulge out to the side and irritate that nerve and compress that. So that's what we're dealing with that type of injury. Now Dr. Brady's going to talk about some recommendations or stretches that we would advise for patients.
Yeah, I'm going to first start with what we definitely recommend you don't do. Because if the mechanism of the injury was a forward flexion, where all of those ligaments are being stretched forward, we hear it all the time. Or people will walk into the room and they're already doing the stretches. Or we ask them what stretches they're doing and they tell us this. And the stretch that they do is either they cross their legs and then they touch their toes to feel like they're getting a stretch in the muscles there. But like Dr. Colton just demonstrated right there, you don't want to do that because the mechanism of injury is that those ligaments are already compromised, maybe microtered, or the disc is compromised in a bulge or a herniation. So we don't want to enact a forward flexion. While that might feel a tension there, it can actually hold you back from properly healing as quickly as possible. So we don't recommend any forward flexion there. The actual stretch that we actually want to do is what's called a McKenzie extension. This is kind of the gold standard in the physical therapy world and what they would recommend to most people with a disc injury or an injury that happened from a forward flexion. It's actually quite the opposite, is to go into extension. I'll demonstrate on the model spine, but then I'll do it myself as well. So if the injury is on the lower back down here, you want to actually get into an extended amount so that it kind of squeezes, if you will, that disc back centrally into the middle of the disc right there. The fluid that's inside the disc, it will suction and bring it back to the center. So I'll demonstrate what that looks like here and talk about a few recommendations of repetitions. So the McKenzie extension here, you're going to lay prone on your belly, on the ground we recommend, and not quite on the bed. But in this position here, you can start just on your elbows. In this position, you're going to slightly bring yourself up. You're going to focus on fulcruming that right at the base of your spine right there. Getting into that fulcrum position. Always start out a little more minimally instead of going rapidly into this to see how your body responds, of course. If this is painful, we don't want to get to the point of causing pain. But start the repetition, you'll come up and you'll hold that position for a good about 5, 6, 7 seconds there, and then you'll slowly relax back down. You'll come back up into another repetition there, kind of back into that, and then focus on squeezing that low back again, right fulcruming in that position, and then coming back down. You can do a series of these, about 6 repetitions at a time. I'm doing this about 2 times a day would be recommended with that there. That is the best thing to do for the low back. With specifics, Dr. Colton and I can recommend more specifics in these series. If you find if that stretch is painful for you, definitely ask us, and we'd like to direct you with more specific stretches that you would need.